it's 9 p.m. in RTD. It's time to English New Edition for tonight headlines. We have the head of state receives the letter of credence of the three new ambassadors accredited to Djibouti. For the international scene, in Africa, nearly 4.11 million cases, according to the African Center for Disease Control. Welcome to our newsroom. The President of the Republic, His Excellency Ismail Omar Guelleh, received this morning at the Palace of the Republic the letter of credence of the three new ambassadors accredited to Djibouti. These include Pamela John, Ambassador of Great Britain, in an address made on the occasions of the presentation of her letter of credence to the President of the Republic, the new Ambassador of Great Britain underlined the excellent relations of friendship and cooperation between the two countries. The President then received the letter of credence from the new ambassador of Sweden, Mr. Hans Henrich. The new ambassador stressed the importance of the relationship and cooperation between the two countries and the ways and means to further strengthen and promote the sustainable development of the country. The Minister of Foreign Affairs and International Cooperation, Mahmoud Ali Yusuf, the diplomat advisor of the head of state, Ms. Fathia Jama'uddin, attended the different ceremonies of presentation of letter of credence. The President of the Republic, His Excellency Ismail Omar Guelleh, also received the letter of credence from the new Spanish ambassador to Djibouti, Mr. Manuel Salazar. In a brief speech, the new ambassador conveyed the greetings of the King of Spain to the President of the Republic. He then expressed his determination to advance the common objectives of both countries to strengthen the privileged ties and relations of friendship and cooperation. The President of the Republic, Ismail Omar Guelleh, welcomed the new Spanish ambassador.
De Sa Majesté le roi d'Espagne, Don Felipe VI, ainsi que celle du président du gouvernement, M. Pedro Sánchez.
The first public sitting of the first ordinary session was held on Monday, 22 March 2021, under the chairmanship of the Speaker of the National Assembly, Mohamed Ali Mohamed, with the participation of the Prime Minister Abdul Qadir Kamil Mohamed, in the presence of the Member of Parliament, Member of Government. The agenda was related to the examinations of draft texts such as the draft law on the ratification of the loan agreement for the integrated water resources management project, the draft law on the ratification of additional financing for the integrated slum upgrading project. The plenary session dealt with the theme of water's housing. After the vote of the bills, the president of the National Assembly shared with the audience at the end of this first public session his recommendation for the April 2021 deadline. The Minister of Health, Mohamed Warsama Diriye, and the Minister of Women and Family, Mumina Humid Hassan, have inaugurated a new mammography service at the Reference Center for Reproductive Health, Husseina. The inauguration ceremony of this new mammography service took place in the presence of the head of the UNFPA office in Djibouti, Ms. Aisha Ibrahim, the Secretary General of the Ministry of Health, Dr. Salah Benoita Turab, senior officials of the Health Department, welcomed by the director of the Hussein Center, Ms. Mako Mahamoud. The two ministers cut the inaugural ribbons of this new mammography service, which is equipped with a new and much more developed breast examination apparatus and an even better reception structures for the patient and users of the center. It should be remembered that this center is the only one in the country equipped with a state-of-the-art mammography machine. Indeed, the inaugurations of this service responds to the dual imperatives of providing quality, specialized care in the field of reproductive health, but also of strengthening prevention and advocacy activities in favor of women. The Minister of Health, Mohamed Warsama Diriye, said that this brand new mammography machine was financed by the national budget and indicate that this new structure further strengthened the quality of the center's technical facilities and will considerably improve the capacity for clinical investigation and creative care for patients. The two ministers then visited the premises and services of the Husseina Reproductive Health Reference Center, accompanied by the director of the center, the Minister of Health, Mohamed Warsama Diriye, the Minister of Women and Family, Mumina Humid Hassan, and the head of the UNFPA, Ms. Aisha Ibrahim, inspected the different entities, including all the curative and preventive care services for women's health. The member of the government congratulated the staff of the center and called on them to persevere in their respective tasks and in their crucial role of promoting reproductive health, which is an important activity for the development of our society. In the framework of the improving the living conditions of the population and more particularly of the vulnerable women, the Ministry of Women and Family, in collaboration with UNFD, proceeded on Sunday 21 March on to the distributions of income-generating activity kits with the National Union of Djiboutian Women. This activity is a continuation of the government's effort to support women affected by the HIV pandemic COVID-19, which has affected the world as a whole. The ceremony was attended by Ms. Mumina Humed, the Minister of Women and Family, Hasna Humed Bilil, the Vice President of UNFD, Ms. Anissa Hassan, Secretary General of the Ministry of Women and Family. The kit consisting of sewing machine, catering equipment, groceries, beauty and perfume products, clothes benefited 112 vulnerable households. The beneficiaries in turn thanked the Ministries for Women and Family for this humanitarian gestures which coincided with this period of COVID-19. The Vice President of UNFD, Hasna Humed Bilil, thanked the Minister for Women and Family for these humanitarian gestures which coincided with this period of COVID-19 pandemic. The Minister of Women and Family, Momina Ahmed Hassan, in her speech said that this distribution is part of the continuity of the government's effort to support women affected by the HIV pandemic and the commitment of the President of the Republic and the First Lady and President of UNFT. The ministry in charge of decentralization organized yesterday, Sunday, 21 March, in Arta, a meeting of the first decentralization clusters coordination group, for which the development of partners were present in force, indeed, around the tables alongside representatives of national institutions, president of the regional councils, their general secretaries, and the team of expertise France, the implementing agency of the support program for decentralization and local initiative financed by the European Union. The meeting was attended by the officials from the Cooperation Department of the European Union delegation, the United Nations Development Program, the World Food Program, the Food and Agriculture Organizations, United Nations, USAID, UNICEF, the French Development Agency, German Cooperation Agency, GIZ. The Minister Hamadou Mohamed Aramis launched the meeting of this coordination cluster group on decentralization and local development issue, the first of its kind, together with the Secretary General of the Ministry of Foreign Affairs and International Cooperation, Mohamed Ali Hassan. For his part, the Secretary General of the Ministry of Foreign Affairs, Mohamed Ali Hassan, congratulated the Minister in charge of decentralization for this initiative of setting up a decentralization clusters group, a mechanism, according to them, very appropriate for inclusive dialogue and partnership building to meet the aspirations for the betterment of our compatriots wherever they are. For his part, the Minister Hamadou Mohamed Aramis, asked the presidents of the regions to think about job-creating project in line with the current government policy and invited development partners to help them with the both expertises and the mobilizations of funding. The participants stated in their recommendations that they shared with the ministers the need for regular meetings of this kind. Listen to the report.
We are hosted in Arta by a very good initiative from the Secretary of State for Decentralization. We're looking at how we can integrate our development efforts to ensure that there is rapid socioeconomic recovery from COVID and there is accelerated sustainable development in Djibouti. The essence comes as a part of the flagship of integrating the national development and moving it into the region. We are listening to different regional initiatives, different priority projects, and it's a critical component for all of us, from development agencies to united agencies participating in the event, but also for us in the national development in the United Nations Development Program. It's a critical intervention to ensure that we are on top of what is the priority needs in each region. It's part of the inclusion process and the institutional building. We are very grateful for the Secretary of State for hosting us today and initiating this periodic discussion. It will be a good future perspective to continue this type of coordination to ensure that we are targeting and reaching to everywhere and making sure that nobody is left behind in the development journey of Djibouti. Wishing Djibouti and its population the best.
Under the high patronage of the Secretary General of the Ministry of Labor, INAP organized a conference debate monitoring evaluation post-COVID-19 in 2020. COVID-19 emerged as a unique and unprecedented crisis that brought the world economy to a standstill in less than 3 weeks, following the example of all countries in the world. With the support of the international bodies, the Republic of Djibouti has developed an action plan to mitigate the impact of this pandemic. To be effective, this program, composed of several components, will have to be monitored and evaluated at each level. The Secretary General of the Ministry of Labor, Mr. Abdel Ali Mohammed, and the Director of the National Institute of Health and Social Welfare, Mr. Shamake Idris, were present, as well as the experts. The experts discussed the different themes, such as the follow-up programs of the NC3 and through the project intended for the youth. After the south of the country, the medical surgical caravan headed north, starting its activity in the city of Tajora. Indeed, this caravan saw the movement of several medical specialists to provide quality care on site for the benefit of the populations of the region of Tajora. The prefect of the region and the president of the regional council paid a supervisory visit under the guidance of Dr. Dimbio, the chief physician of Tajora. This policy of proximity health wanted by the President of the Republic is a relief for the population of the region who do not always have access to specialist doctor. It should be noted that not less than 1,200 people were consulted during the 2 days of caravan. The population thanked the Ministry of Health for the implementations of the caravan. The chief medical officer stressed the importance of this type of activity in his speech. The Association for the Promotion of Women's Sports and Cultural Activity, in collaboration with the Djibouti National Olympic Sports Committee, organized the celebrations of the International Women's Week yesterday, Saturday, 20 March, at midnight in front of the Djibouti City Hall. The day was dedicated to women's sports and featuring several disciplines such as tekball, kung fu, karate, judo, and taekwondo and football, in the presence of the president of the Association for the Promotion of Sports and Cultural Activity for Women, Ms. Saida Sikin, thanked the police who provided security, and the vice president of the Women's Football Commission, Mr. Fathiya Usman, the president of the Djiboutian Tekball Federation, Ms. Amina, and the president of the Youth, Ms. Nima Abdullahi, as well as the elected officials, Ms. Sabah Salim and Salma Salah. As usual, the day ended with the awarding of trophy and medals for all the participating disciplines. For the international scene, the total number of COVID-19 cases in Africa on Sunday stood at 4.11 million. The African Center for Disease Control and Prevention is African announced Africa, the specialized health agency for the African Union, said the death tolls from the pandemic in Africa had reached 109,000 deaths, while 3 million patients have recovered from the disease. The worst affected countries on the continent in terms of death are South Africa, 52,000 deaths, Egypt, 11,000 deaths, and Morocco, 8,000 deaths. The agency noted 9 African countries have recorded more than 100,000 confirmed cases so far, including South Africa, which has recorded the highest number on the continent, exceeding on 1 million infections, the same sources said. This is it for the news. Thanks for watching us. Have a good evening.